everyone. My name is Daisy Daniel. I'm a doctoral student at University of New Mexico and the chair of the AMCD Professional Development Committee. And today we are talking with Dr. Cartwright's team about creating and cultivating equity, grant writing, and medically underserved communities. So Dr. Angie Cartwright is a primary investigator and the project director, and she's also the assistant professor in the University of North Texas counseling program. She, as the primary investigator and project director, will manage the project, ensure implementation implementation and prescribed activities are carried out in accordance with the objectives and coordinate project activities. So today I'm going to have Dr. Cartwright introduce the rest of her team so we can get to know them as well.
Good morning, everyone, and good afternoon, depending on your time zone. I think we're all chiming in from different places. It's still morning here in Texas, so good morning from us. As Desa stated, my name is Angie Cartwright, and I'm an assistant professor at UNT and one of the project directors for our Integrated Care and Behavioral Health Project here at UNT. And the rest of the team members will introduce themselves.
I am Peggy Ceballos, and I'm an associate professor here at the University of North Texas in the counseling program. And I am a co-PI on the grant that we're presenting on today.
Hi everyone, my name is Dr. Chandra Carey. I'm an associate professor and interim chair for rehabilitation and health services. I'm faculty in the rehabilitation counseling program here at the University of North Texas, and I am also a co-PI on the grant project.
And I'm Joey Tapia Fusile. I am a second-year doctoral student at the University of North Texas, and I am the graduate assistant on the project.
All righty, so I guess we'll go ahead and get started. All right, so our presentation for you today is Creating and Cultivating Equity, Grant Writing in Medically Underserved Communities. So after the end of our presentation, we're hoping that you'll be able to describe a few ways that grant writing can help benefit counselors and counselors in training, specifically in your counselor education programs, that you'll be able to search for and locate opportunities for funding, and then also implement techniques to establish internship opportunities and partnership sites at your respective communities and universities, and then explaining how to enhance your students' knowledge of medically underserved populations and communities, as well as explaining and enhancing their knowledge on integrated care. So just a quick overview of our project. So we were funded by HRSA. HRSA is the Department of Health and Human Service, and specifically we were funded under the Behavioral Health Workforce Education Program. BWET is the acronym for that. And our specific project is expanding cultural and linguistic appropriate services to integrated care and behavioral health settings. So our hashtag or our acronym is ICBH, and that ICBH stands for Integrated Care and Behavioral Health Settings. So this was the first formal collaboration between the counseling program and the Rehabilitation and Health Services Department at UNT. So it was a really neat opportunity for us to collaborate amongst our different departments and to really make sure that our students are getting a comprehensive view of counseling and the counseling profession with both professional counseling and rehabilitation services. The goal of our actual project is to enhance the delivery of culturally competent mental health services for medically underserved communities in those behavioral health and integrated care settings. Before the end of our project, our presentation today rather, you'll learn a little bit more about integrated care and hopefully a few more ways that your students can interact with medically underserved communities, or MUCs as we call them. So the goals of our specific grant project, or the ICBH project, was to increase the number of students who are qualified to work in integrated behavioral health settings. So what we know is that SAMHSA has 6 levels of integration, and we found that our students were typically working in levels 1 and 2. And Dr. Carey will explain a little bit more about levels of integrated care later on in our presentation. But our goal was to have our students work in higher levels of integrated health settings And over the course of the grant, our grant project is 4 years. And at the end of those 4 years, we will have 80 students participating in the project, working at higher levels of integrated care settings. And each of those 80 students will receive a $10,000 stipend for their work in their internship settings and integrated care settings. And then we were wanting to increase the diversity of professionals in the workforce. And so basically, for our particular project, we are focusing on students who have a strong passion and desire to work with MUCs or medically underserved communities. And we are training counselors and mental health professionals in the DFW area by bringing in experts from across the country to speak on integrated healthcare and counseling medically underserved communities. So our trainings have typically been free, and we provide lunch and CEUs for professional development and continuing education. And then we're also wanting to increase the involvement of families and the support systems for our clients in the community. So to get down to the fun stuff, grant writing, some people don't necessarily think that's fun, but it's fun for me. So we'll talk a little bit about how to locate some funding sources and the different types of funding options that may be available to you. So university grants, private foundations, state grants, and federal grants. So for us, when we were looking for grant sources, we had this idea of kind of what we wanted to do. We're like, well, where can we get the money? Where can we find things? So we have a search engine here on campus through our grants office called Pivot. And Pivot is very similar to Google, but it is for grant funding sources. And so we looked in Pivot for funding sources. We perused Google and different state funding agencies to see what we could find. And we signed up for all of the electronic alerts for a lot of the funding sources so that as soon as a funding opportunity was released, it would come directly to our emails. So first, to talk about university grants. So I would recommend checking in with your university about seed money that they may have available, especially for assistant professors. For example, here at UNT, assistant professors are eligible to apply for $10,000 of seed money for grant project ideas that they may have. And so that $10,000 of seed money would help to build a project and to get a project started so that you have maybe some preliminary data when applying for federal grants. There are also smaller university grants that assistant professors could apply for, mentorship grants. An example of how we could have used a mentorship grant is if we had someone that we knew at a different university who had applied for this particular project. The mentorship grant could have paid for that person to come to the university and meet with grant staff here, could have paid for meetings and travel for us to go back and forth with those different mentorship opportunities. So that's an example of the seed grants that we have available here at UNT. And I would say that it's pretty typical for maybe some universities to have smaller grants for launching new projects. And then private foundations. What we found is that private foundations, there's a beauty in being funded through private foundations. The oversight is not as challenging as with state and federal grants. With private foundations, the money that they may provide is more of a gift than a grant. We have a few people here on campus at UNT and specifically in our colleges who work with donors, alumni, and they go out and meet with faculty to see what our research interests are, and then they pair us with foundations or private donors who have personal interest in our research topics. And I think I'm going to turn it over to Peggy just a little bit to talk about her experience with private funding and private foundations.
Sure. So right now I'm actually having about 2 or 3 different small research funding that came from private foundations, and what I did was to get in contact with the person here in the university that is in charge of contacting these private foundations and private donors, and talk to them about my research, which primarily focused on working with Latino and Spanish-speaking populations in the area, and there is a big need right now in the area that we're in for that. So a lot of the private foundations want to fund that type of research and service, and many times they're not really as concerned about the research as they are concerned about the service, but they understand that we do carry research with that service. And so they usually are very good about donating money to allow us to reach out to the population and to provide these services. And what I have found is that it's a lot easier, because then what they're asking for at the end is more of a report about how many clients were served. And so it doesn't carry a lot of the same type of follow-up that a federal or a state grant would carry.
Thank you, Peggy. And then there's state grants and federal grants. And Chandra and I are working on a state grant right now, as well as our federal grant. And the state grant is closely aligned with the federal grant that we're talking to you about today. But there are a few reporting requirements that are a bit different, and I would say a little more challenging with state grants than federal grants. We found our state grant actually through Chandra, because she was previously funded. So our state grant is through the Texas Higher Education Coordinating Board, located in Austin, Texas. And so what we found is that state grants may not fund as much as the federal grants, but the oversight is a bit tighter, and there's a lot more reporting. And so I would recommend, if you are wanting to launch a project, or if you have a smaller project, looking for state grants and making sure that that you have the time to report exactly what they're looking for. And then, of course, our federal grant, and we found our federal grant through Pivot. So we have a couple of grant writing tips for you. So I think the main one is to make sure that you're using a program development theory or a logic model when actually crafting your project or your idea. It's really, really important that, that there's a streamlined process for creating the project that you're wanting to implement. And typically funders will ask for a one-page overview or summary of your project, and that's typically through a visual depiction of a logic model of some sort. And we do actually have a template of a logic model for you that we can share at the end of the presentation so that you can see what one looks like. And it's a fillable template, it's a Word document, and so it's workable for you to type in. It's actually an assignment that we use in our grant writing class here on campus, and the students actually love it. We've had several students who have used the logic model template, and they've actually written grants, and some of them have been funded in their current counseling positions at their community agencies. And then the second thing is teamwork and collaboration. We stated earlier that our grant project was the first formal collaboration between the counseling program and the rehab counseling program here at UNT. So that really gives our project a different spin. It's really important that we work together as experts in various areas for the betterment of our students and of the community. And so it's really, really, really important to reach out and to know that there's enough room at the table for everyone, and just sharing knowledge and making sure that all of our students and community members benefit from the work that we're doing. Another tip is to ensure that your vision and that the purpose of your project aligns with the funder's mission. So I would recommend going out and actually doing some research to figure out what is the vision and the mission of the funder, and to craft your project in a way that speaks to the overall goal that they're wanting to achieve. And then to cover topics in the RFA, one of the things that we did is we created like a rubric. We looked at the RFA and we're like, okay, so we're professors, and if we were grading a grant project, how many points would we dedicate to this? And how many points would we dedicate to that? So we created a rubric so that at the end of our time crafting and writing our grant project, we could grade ourselves to figure out what we needed to add, what we needed to take away, and kind of weighted our grant project or our proposal based on the rubric that we created. Sometimes there are rubrics available. Google is your friend. So if you Google expired RFAs or expired calls for grants, they may have published previous rubrics, and so you may be able to see how they scored presentations in the past. And so if you're able to find that for your grant project, that would be great, because then you can use something that was already published and you know that they've actually used that score sheet or that rubric before. And then when we talk about grants, it's almost impossible to talk about grants without talking about money and budgets and all of those things. One of the things that was really beneficial for us is we had support staff on campus that were experts in building budgets and working in Excel. I am not an Excel person at all. You can give me anything in Microsoft Word and I will figure it out. But if you give me an Excel spreadsheet, I kind of go crazy. But these people are experts in Excel, and they were able to help us figure out percentages and make sure that we are hitting all the financial targets, and really helped us to craft a succinct and realistic budget as well as a budget narrative for the funds that we were requesting. One of the things that we really wanted to ensure is that we provided information in our application on sustainability, and we would encourage you to do the same. Funders really want to make sure that if they are providing funding for your project, that at the end of your funding cycle, that your project is going to be sustainable. Nobody wants to give $300,000 or $400,000, and then when that money is gone, the project ends. So it's really important that you address sustainability in your grant project so that the life of your project extends past your funding cycle. And then mentorship and consultation, advice from previous grantees. Oftentimes with both state and federal grants, you're able to look online to see who was funded previously. And if you reach out, if you know any of those people, they may be willing to help you maybe by previewing your project or being a consultant on your project. For example, with our current ICBH project, our consultant, she is our external evaluator and she's a consultant. She was a previous a grantee from the exact same project, so she kind of knows the process and what they're looking for, and she's been able to help us with some of our internal processes and procedures because she's actually had the exact same grant. And then the next bullet was to score and using rubrics, and we've kind of already talked about that. So I'll move on to the final one, data, and more data. So making sure that you use data to craft your project idea, make sure that you support your ideas with data, that you provide statistics and factual information in your application packets, and then making sure that you collect data, because the only way that we know what we're doing is working is if we're collecting data from our students, from the clients, and actually from each other as well. So it's really important that the data is a huge part of your grant process.
So I'm going to talk a little bit about things you need to consider as you're looking for appropriate sites to partner with and trying to locate your clinical partnership sites. And so one of the first things we think about is conducting a needs assessment. And one of the general questions I had when I was a doctoral student is, what exactly is a needs assessment? And generally what it is that you're collecting data on what currently is occurring at the site that you're working with, but you're also kind of looking for opportunities where there are gaps for you to improve the services that are provided. In one of a new state grant that I'm working on, we're looking at rural communities and mental health in those areas, and we're doing a community-based needs assessment. So needs assessments have different levels to them. So there are some that are organizational and some that are community-based. But essentially what you're looking for in both of those areas are how you can change the physical scope of what's happening at the agency or in the community, the social policy scope of it, and then the environmental scope. So for our particular grant, when we're looking at the physical aspects of it, when we talk about integrated care, and I'll visit a little bit with the levels in just a few seconds, when we talk about integrated care, one of the highest levels of integrated care based on SAMHSA is when you have service provision all housed in the same space. That's a significant physical change. And so while you're looking at the sites that you want to partner with, you're looking to see, okay, so your average everyday community-based mental health agency may not have someone who provides medical care or a nurse or psychiatric person on site. Is there space for that? Is there something that they could accommodate? Is there a way that you can change that physical scope? Because in the needs assessment, what you're essentially doing with the site is selling to them how you're going to improve the services that they provide, and they're very interested in that. They want to make sure that they have the best service provision, and they don't always have the staff that can facilitate that. And so when you're working with your clinical partner sites and you conduct a needs assessment, you're really trying to present to them how you can help improve the services that they're going to provide to the populations that they serve. Another thing that's really important to consider is looking at statistics. And so I'm just remembering a really funny meme that I just saw about the difference between data and data. And so when Dr. Cartwright mentioned data, I was like, oh, I say data. So the data is just really important. You want to kind of get a sense of who's there, who are you serving, who is the agency serving, what are their needs, what have their outcomes looked like in the past, how can you improve those outcomes. You want to kind of see what the landscape looks like in that region as well as nationally, so that you can provide some comparison data to say, so in the DFW area, we have some really significant issues in regard to mental health services. In a similar bordering state, well, I guess it's not a bordering state, but if you look at California, where they also have a similar population in regard to medically underserved communities, what you find is that the service provision levels look differently. And so you might be able to present that data to the agency that you're working with to say, we want to see where you're at right here and take you to this other space. And here's a comparative model of what your data could look like, what your outcomes could look like after we interact with you and we carry out our grant project. Another aspect that was really, really important to us in this, as we came together, was looking at what the experiences are going to be for the clients and the students. On the end of all of this, I think for all of us as counseling professionals, is how are the clients going to benefit? What are their services looking like? How are the services that are provided going to change their lived experience? And so you also want to make sure that you can talk about who the clients are, understand who the clients are at a particular site, so that as you're negotiating with them and providing them some insight on how you can improve their services, you're really keeping their clients at mind. And you're providing them a pocket of people who can help facilitate that through your students. At the same time, the students are able to gain some really tremendous experiences and sites that they might not have otherwise gone into because of your grant project. And so you're enhancing the outcomes for the site, the students, and the community population that they serve. Another thing to consider specifically with our grant is the health professional shortage area, the HPSA. And so for this particular grant, when we look at medically underserved communities, that's exactly what we're talking about. We're talking about these areas where you have high need, high risk individuals, but you have individuals who have low levels of access, low levels of utilization of services. And so because there aren't a lot of professionals in that area, one of the things that was really essential to us was to not only provide our students to those sites, but to provide educational opportunities for the individuals already working at those sites so that they can enhance their service provision as well. And so when you use key terminologies like that that come from SAMHSA and looking at how you can really provide integrated care, you want to make sure that you're able to articulate that this is something that has been federally recognized. This is a challenge that we are prepared to help you meet, and that by participating and partnering with us, there's a gain for the partnership site as well. What we know historically in regard to research and data is that oftentimes researchers, university faculty go into sites, they conduct their research, they walk away, they have their paper, and then the sites are always left with the question, what did I gain from that? You want to really do a lot of relationship building with the site so that when you do enter into a formal partnership with them, there's full buy-in. They believe in you, they understand why you're there, and they believe that you really are interested and invested in the outcomes for them and their community that they provide services to. The last aspect of that is looking at funding and resources. Sometimes sites will have internal resources that they can provide. They will have opportunities where they maybe have applied for funding in the past and haven't been successful. I always like to see those as opportunities where you can say, okay, so you applied for this particular grant opportunity, you were looking to meet this need, that wasn't successful. Let's see what it was that you applied and how we can modify that and bridge that into our existing projects so that we can still help you meet that need, but then also gain some additional information ourselves. You want to make sure that you kind of work with the partnership sites in regard to what would be a good resource, what is a good funding agency and outcome. One of the challenges I've had in the past in working with state grants in a different state from Texas was if you're working with the partnership site and they have a different philosophy or mission than the state funding source does, where they are kind of reaching different outcomes. And so you want to make sure that, again, there's that buy-in and there's just a lot of relationship building on the front end of that project so that you can really be on the same accord and the same page as you move forward, and the funding sources that you provide align, and the goal and scope of that align with what that particular agency or that site wants to achieve. So here is some of that data, depending on your preference, about what things look like here in Texas. So what we know is about 46% of adults experience mental illness at some point in their lifetime, and 26%, that's about 1 in 5 adults, experience mental illness annually. Way back in 2013, Texas kind of looked at all of the counties and looked at the health professional shortage area and noticed that there was a significant amount of counties in the state of Texas. So the need was kind of presented through that data collection that happened through the health professional shortage review. In the DFW area where our grant is located, which is the Dallas-Fort Worth Metroplex, about 38% of individuals in Dallas County are residents who are Latino, 22% are African American, and 14% of all those residents are living below the federal poverty level. So when we talk about medically underserved communities, that doesn't always automatically equal looking at populations of individuals from racial ethnic backgrounds, but oftentimes because of the intersection of social policy and class, you do tend to see individuals from racial ethnic backgrounds captured in that. But that also includes those individuals who have lower socioeconomic statuses, lower social capital, individuals with disabilities, the aging population, all fall within rural communities, also all fall within what you look at as that medically underserved population. There is a high risk because of environmental factors, because of lack of medication, medical prevention, of occurrences of mental health disorders amongst the population of medically underserved communities. And so we had a really, I don't know, it was kind of like the ripest fire brewing in Texas for this particular grant at the time that we were ready to kind of join together and work on this, which is unfortunate for those communities, but the opportunity is that our grant is now here and we can really make some strides to kind of address some of the issues that are presented in the DFW area. One of the other things you'll notice with medically underserved communities is that those individuals tend to have limited access to qualified health providers and professional counselors. When they do have access to professional counselors, and those counselors oftentimes are not representative of their linguistic abilities or their cultural backgrounds, which we know can provide a barrier to those individuals accessing those services. And so with our grant project, with us trying to make sure that we're putting more students who are invested in looking at cultural and linguistic differences, and we're also educating the individuals at that site, we're hoping to broaden the access that individuals will have to qualified health providers. What we also know in some of those areas, and just in general, is that there's a low level of integrated healthcare internship opportunities. And I think that's probably accurate across the discipline, simply because for a very long time, behavioral health and physical health were parallel systems. But what we do know now is that when you have the integration of those services and you're treating the individual holistically, then you really do have higher success rates, better outcomes overall for the individuals that are served. One of the really neat things about our projects is that while the students are there, they're going to kind of make an assessment themselves of what type of level setting that they're in. Is this a level 1 integrated care setting, or is it a level 6 integrated care setting? And if it is a level 1, we can help them to think about what kinds of things can that site implement to take them to a higher level. What that will do is provide opportunities for students to go into integrated care sites that have a higher level of integration. But even when that site doesn't have a higher level of integration, having an individual there who's acutely in tune to the benefit of integrated care can really make a difference in that site for the services they provide and for the people who receive those services. Right now, for our students at UNT, about 80% of them are in settings that provide services to medically underserved communities, a vulnerable population, but only 12% are in integrated care settings. And I probably would say that's in high integrated care settings, because all settings fall somewhere along that spectrum. And so even if you don't have any level of integration, then you're level 1, which is what Dr. Cartwright referred to earlier in regard to most of our students are at level 1 or level 2 settings. And so that's kind of what the landscape looks like for us in our project in this immediate area.
Can I chime in really quick?
Sure.
So Dr. Carey addressed earlier, she mentioned having the buy-in of the partnership sites or your internship sites. One of the things that we've been able to do is offer a consultation to have, to be able to provide something else for them. So we say, hey, if you're currently at a level 2, our grant team will work with you to figure out what level is realistic for you, where do you want to be, what do you have the resources to go, and we will craft a way, a vision to help you get there. So not only are they benefiting by having interns come to their site and gain experience and provide counseling services to their clients, they're also benefiting as a system, as an agency, by having our consultation from our grant team as well.
And I was also thinking about adding how we're also having students who are in school counseling settings, and usually when we talk about integrated care, we tend to think about the clinical settings. And what we have found is many of our students are working in schools where there is a large number of minority students who fall under the medically underserved clients, and so that helping them to also see how within the school system and the school building, the concept of integrated care can be applied and how they can help facilitate that as the school counselor, and it's part of also what we're trying to do.
Finally, is just talking about in regard to our partnerships, how you establish new partners. And so this is going to be a little contrary, but one of the great ways to establish new partners is to look at your existing partners. Try to get a sense of who you're working with currently, what their needs are, if you conducted a needs assessment. And a needs assessment doesn't always have to be a formal process. Sometimes it's just you taking note of what's available, where the gaps are, and being aware of that. And so if you're looking at your existing partners, you can use some pre-existing relationships that you have to help build new partnerships or to connect with other agencies that might provide similar services. And so that's a good way to establish those partnerships. The very first bullet, I think, is probably the most critical one, and that's building the relationships with clinical partners in both integrated care and behavioral health settings. I used to do a lot of participatory action research, and one of the, premises behind that is that you really do build a relationship. So you walk into that site initially without any ask. You're really just trying to figure out who that site is, get them to understand who you are, and build a relationship. From there, then you provide them something. And so you go in, if you're going into an integrated care setting, you might do that mental needs assessment and say, hey, I'm noticing that you have people who leave out of here who maybe have just received a diagnosis. Maybe they seem a little distraught. There might be a possibility that behavioral health could kind of intervene at that moment and provide some additional information to that client, some support to them, so that when they return, they're more medically compliant, they comply with their medication, and they might buy in with you a little bit more in the treatment that you're recommending to them. In the same vein, you might go into a behavioral health setting and say, I'm noticing that from your clients and the background information that you collect on them, that there's a lot of co-occurring conditions going on here. Wouldn't it be great if they had access to a medical provider or a nurse practitioner who could kind of look at them in the same setting, so that you don't have to worry about, well, if I send them here, they might not return. And so you build that relationship, you don't have an ask, then you give, then you can start to really work on a framework of, okay, so here are things that you have that you need. Here are things that I'm interested in providing you. How can we merge this together? And so by building those relationships in those different settings, you've already got some really good groundwork to try to integrate those two and to present the type of grant project that you're looking for that's focused on integrated care. You always want to personalize the communication. You kind of never go in blind. And so it's like you think, okay, I know that I'm going into this particular setting. I want to understand who their clients are. I want to understand what the community is that they provide services to. I want to understand who their staff is, so that you can really personalize that communication with that site. They understand then who you are. They know that you have done your homework and you understand who they are, and that really does help. The other one, in regards to developing a strong social media and digital presence, I think that really goes to staff. And so one of the critical things that I think Dr. Cartwright and I learned from another grant that we've been working on is that finding the right staff is essential because they are a really critical component of the team. And we've been fortunate to have great staff to help us develop that strong digital presence and a social media presence. If you think about how people access information today, it's not kind of like when I was in school and I would go to the library, pull out this big book and kind of flip through looking for things. Everything is kind of at hand. And so if you really want people to kind of think, oh, I need some kind of service, what can I do for integrated care? And they Google integrated care and your particular funding source pops up, or some type of training that you facilitated is what populates through Google, then you are building this presence and people are getting more buy-in. They're like, oh, well, other people know about this. What is this program doing? This is pretty neat. Maybe I want to be involved. And that can help you. You might even have people contact you, which I think we have for this grant, to say, hey, I'm interested in this work that you guys are doing. How can my agency and my organization be involved in it?
All right, so currently what you see are some of our current partnership sites. The project was really intentional in wanting to develop, well, first look at existing partnerships and also identify where they fall under in terms of integrated level of care. We really wanted to target federally qualified health centers, which are more, 5 or 6 in terms of integrated care, which will be explained after this. So it was our goal to increase some of those sites for our students. Currently, we have 6 tracks that students can fall under in terms of clinical route. So we had to really find opportunities for them in these settings that targeted adult, adolescent, child, community, university, university counseling, school counseling, and rehabilitation. So we had to really explore what was available in the DFW area that would meet these needs of the students and also provide them that exposure to integrated care working with medically underserved communities. And one of the examples of some of our students have been at the Irving Family Advocacy Center. That from the students' experiences, they're in a space where everything is on site. So if someone claims there's child abuse, they have a police on staff, they have medical examiners, they have case managers, they have clinicians available to provide services. So truly our goal in finding sites, which we hope to continue increasing for our students to have diverse experiences, is looking at how we can identify those federally qualified health centers and also assist, as Dr. Cartwright was mentioning, other lower levels of integrated care settings to increase, and how our students can kind of help that process in getting them at a higher level of integration.
And then, as you've heard, so far our project really has also a major goal, which is enhancing or transforming their internship experience for our students. And it specifically wants to focus on 2 major areas that we want to enhance: knowledge and enhance competency for our students. And that one is the multicultural area, and the other one is on knowledge about integrated care. So for multicultural, we know that all of the students that are in internship they have had at least one multicultural course for a whole semester. They were exposed to some of the basics, concepts in multicultural, the multicultural competence and social justice advocacy competence. What we want through our grant, what we want to do is to be able to enhance that knowledge and to continue to help them to continue to put into practice all of that knowledge that they gain during that one course. So some of the courses that we have specifically is for them to review those definitions of privilege and oppression, but go deeper with them in understanding, increasing the awareness of their own identities as counselors and how their intersectionality of identities affect the client-counselor relationship. We want them to increase the awareness of the experience of clients who experience oppressive factors. How are those oppressive factors influencing the client's presenting problem? And then based on that, understanding of the impact of those oppressive factors on the socio-emotional development of clients is what does that mean in the counseling program, what does that mean for treatment planning. We want our students to be thinking about actions, what kind of advocacy do we need to be engaging in as part of the treatment plan if we really want to be able to help our clients to deal better with these oppressive factors, right, or to minimize the impact of those oppressive factors. And in a little bit, I'll talk more about how specifically we go after those goals. But for now, I also wanted to turn it down again to Chandra to be able to explain more about the integrated care that we've been talking about so far.
So I realized I mentioned an acronym earlier that you all might not be familiar with, SAMHSA. Counseling is kind of like an alphabet soup sometimes with all of the different acronyms that we have, but that's the Substance Abuse Mental Health Services Administration. It's a federally funded agency that's within the Department of Health and Human Services, and they developed a spectrum of what integrated care can look at, and what you have here are the different levels of what you might see. So level 1 at a minimal collaboration is probably very typical to what most counselor education students will experience during their internships, a school setting or a community agency where they're providing strictly behavioral health services. Or you might be someone who's in an agency that is strictly serving physical health needs, just a doctor, physician, nurse, there isn't any behavioral health there. And then it goes up various levels where you get greater and greater integration until you get to level 6, which is optimal. And so the way that it's laid out very linearly looks like, oh, okay, so it's great. So if I'm here and I'm only providing behavioral health, I'll just bring a physician in and then I'm automatically at a different level of care. And it's a little bit more complex than that. And I can just give you a very brief example. When I was in Michigan, that state developed what they call one-stop shops for individuals who have disabilities. And so in that setting, they brought all of the different services that they would need: employment services, career planning, housing, just the full gamut of what you might think of, medical physicians. And so they typically were at kind of what you would see as a level 3 basic collaboration setting, where you have all of these different services provided on site. The challenge with that particular model, because it wasn't successful, was that there wasn't buy-in from the different partners in the regard that we actually have to collaborate. And so there was still a lot of territorialism between the physicians, between the mental health practitioners, between the social workers, between the rehabilitation counseling, between the clinical counselors. And so there was just a lot of territorialism because there wasn't that buy-in. So although there are these levels, and SAMHSA has kind of designated kind of these definitions of going from basic to close to full collaboration, I think there needs to be an understanding, and this is demonstrated in the SAMHSA documentation of what that level of what collaboration needs to look like. And so if there are individuals that are all on site, there still is some basic sharing of information, which can go into HIPAA and can go into other types of releases of information so that you can have that not all agencies might have buy into or might need to have or understand, even depending upon the levels of integration of the levels of agencies you have involved. But this is a great model to kind of look at when you get to level 6, when you have full collaboration, which oftentimes will look like a hospital system, where you have psychiatric care on site, you have medical care on site, you have social workers there, you have behavioral health service providers in that setting. So you might see someone, there's a hospital here that's Parkland Hospital, and that system is what we see as a level 6 integrated care setting. That's an optimal setting. But even with that, with those individuals being on site, there's very close collaboration. There's shared records. They share their electronic record keeping services. And so they actually do have a very integrated system of care so that they can holistically meet the needs of the clients or patients that come in to seek their services.
And we provided some links to handouts for you. So when you receive the PowerPoint, then if you click on that integrated care, it's hyperlinked for you so that you have some documents to peruse as well.
So we wanted to take some time to talk about how we're doing this. How are we going about within the structure of our grant? How we're enhancing the students? And also practitioners in general in the community, because that is our goal. It's not just to enhance the multicultural training and the training on integrated care for our students, but also for our clinical partnerships and the clinicians in the DFW area. A way that we have been doing that is to offering workshops. We have by now for internship 1, there is one workshop, a whole day workshop that we offer on a Saturday. And half of the workshop will be a speaker who concentrates on integrated care. And this is when we bring nationally recognized experts in the field who can come and do a more in-depth training on just specifically integrated care, always with that focus on multicultural competence. And we are very strategic about targeting speakers who we know can speak to both, to the integrated care and the multicultural experience. And also then the other half of that training is a multicultural expert. And we bring somebody who is well recognized for the multicultural expertise in counseling and help them to provide a workshop that really goes more in depth with all of those goals that I read to you in the previous slide. So students are asked to attend that Saturday workshop during internship 1, and then another follow-up workshop during internship 2 with 2 different speakers. And actually for this year, we're also considering for one of those to have a panel of experts so that we can get even more hands-on and really get to how you apply a lot of this knowledge and concepts into your actual work and what you're doing right now in your sites. These workshops are open and we advertise to all of our clinical partnerships, and it's open to any clinician in the FW So we just offer as many spaces we have available. So far, we've been able to do these workshops in rooms that holds up to 100 people, and we have been many times we have 110, 120 people registered for our workshops. And by doing this, we're helping to ensure that we're also offering these services to the community and making a difference in the community. We're also asking our students to create workshops that attend to their needs, specific needs of their internship. And the idea of asking them to create these workshops is to help them also to see how they can attend to the needs of their internship side and their clients. And with that specific focus on how you do it in a culturally responsive way and how do you do it through this integrated care framework or through that lens, and how you offer those services in your internship side. We found during our first cohort of students that they were saying many times they needed to be able to talk to each other more, because as we have explained so far, many of them, one of the challenges is that we don't have that many settings that are a level 6 or 5 or 4. So a lot of our students are being placed in lower levels of integrated care, and there is a need for them to be able to actually talk to each other about ideas, brainstorming ideas on what is it that we need to do in our sites? How can I help my site to go up in those levels? Based on that first experience that we have now, for the second cohort, we're creating more opportunities for focus groups where they can come together, talk to each other. I know for the school counseling, students in particular, it's even more challenging sometimes. And so we're really encouraging them to have that focus groups with themselves and to help to talk about this and how they can maybe take some of these ideas and deliver them in their settings. We also have online modules and we create some specific PowerPoints, again, related to integrated care and multicultural counseling. And those are online and accessible for free for community members as well as our students. So on top of the workshops that we offer, they can also access those online models and learn more about some of these concepts. One of the main areas that we have noticed we have a need in the DFW is attending to the needs of linguistically diverse clients. We have a high need for Spanish services and just not enough providers who are bilingual to provide those services. And based on that, we have been really targeting that specific area. And one of the things that we just implemented was to create an online module that talks about how to use and formal training on how to use translation services in the session. We did not want to just focus only on linguistically, just on the the Spanish issue that we have, or that lack of Spanish-speaking counselors. We wanted to go beyond that. So we also added part of the presentation. Enjoy this part because he's an expert in this. Is how to provide translation services as well for in sign language, and how to be able to attend to the needs of clients who need the sign language in the counseling room. We also want to continue to enhance, and we're focusing that on the second cohort, enhance more their understanding and their competence on how to attend to disability accommodation and services within the counseling room, and for clients who are specifically needing this type of accommodations. We find that many times, even in the multicultural classes, these are some areas that are not covered. The attending to the linguistically diverse clients and clients who need accommodations for disabilities is something that is not being covered, and our students are saying that they really are needing more of that training. So as I said before, for partnerships, we also want to enhance as well this training, and we are trying to provide them with high quality training to be able to help them to see how they can be more culturally responsive to their clients, how they can use translation services, and definitely that whole idea of integrated care. How can they hire those levels of integrated care within their sites? Part of what we do for this, and we're doing it this second cohort, is offering the trainings that if they want, as Angie already said, we can provide consultation services. So they can meet with us as a grant team, and we can sit with them, look at their needs, at their population, geographically where they're located, and based on all of that assessments, this is a plan on how you can move forward into more integrated care within your site. It has come with some challenges, and so we did not want to end the presentation without talking to you about some of those challenges, because it sounds so wonderful. And then when you put it into practice and you really try to make it reality, obviously there are things that happen that we have found that have been kind of hard for us to overcome. And it has created opportunities for us to really brainstorm into how we can do this. One of the challenges is that many clinics have traditional clinic hours, and medically underserved clients, who usually are minority clients or clients that live in poverty, need different clinical hours. Specifically weekends, we have found that some sites do see clients up to like 7 p.m., 8 p.m., which accommodate for some of the clients that may have a job until 5 p.m., but we find that if we wanted to be more successful in reaching out to this population, that we may need to find more clinics that will provide maybe Saturday services to the clients. So that just some of these are things that we can address and some we can't, but we could maybe offer these kind of feedback to the clinics and try to see if they would be open to change some of these. The other one is the mismatch between a student and client demographic and language, and I already talked about the lack of that we have in terms of providing services to linguistically diverse clients, but also just demographically. So a lot of our students, even though we want to, and one of our goals is to increase the number of minority students who come into the counseling profession at this point, that is not the demographic that we have. And so then helping the students understand what that means in the counseling room and how they can address those differences and how they can have more of an understanding of a different perception from a client that is very different from them has become the way that we really are trying to overcome this. Setting that have a high need of translation services, as I said, we are trying to target that by providing this training, but we are finding that not every site is open to that. And an example, we just visited a very level 6 integrated care site, and they were talking about how many clients they're not serving because they speak Spanish and they don't have enough Spanish providers. And when I offer, can we provide this training to you and actually look for professional translators in the community that may want to partner, they were not open to it. And so we're finding this and we're trying to still brainstorm what do we do with this and how we can offer maybe more, more support for them to be able to address this issue. I don't know if part of it may be that they're really not aware. They've never done it before, and so they're really afraid to use it. They're really afraid of what that means. So it may be that we need to reach out for more education. Then yes, distance and location has been an issue that a lot of our the clinics that may accommodate more of the medically underserved clients are clinics that are far away from our university. So students have a hard time compromising to wanting to go to those distant internship sites. We're hoping that paying them for their internship experience is helping to for them to reconsider that and to go into those sites. And we already talked about the last bullet point, which is really fewer sites that have high levels of integrated care and how we're trying to meet that need in the community by providing consultation services. So at this point, I know we only have a few minutes left, but if there are any questions that we can answer, we'd be happy to.
Yes, thank you so much. That was awesome. So we have a question from Dr. Sean Smith who says, Dr. Cartwright, thank you and your team for this presentation and valuable information. With the shift in funding initiatives from the federal government, have you experienced any difficulties in maintaining your project or seeking additional funding from the federal government to continue your project?
We have not. Thank you, Dr. Smith. That's a great question. We actually haven't. So when we applied for this particular funding opportunity, we were funded for 4 years. And so they gave us an overall total of what they were willing to fund, and they broke that up into disbursements of 4 years. I will say that we got an email last year that kind of it kind of shook us to our core a little bit. And so basically that email was like, well, you may not be getting your money for year 2, but everything worked out. So with the government shutdown, we're interested to see how that's going to impact year 3 and the release of funds. At this point, fingers crossed, we haven't had any issues other than that slight scare of an email last year, like I think it was in April.
Awesome, thank you. So we have another question that comes from the National Association of Black Counselors. It says, hello, Dr. Cartwright and team. Thanks so much for this information. It will be valuable as the National Association of Black Counselors, Inc. establishes and expands its internship and residency program. What were the 6 areas that students were placed into at various sites? And that is from Tamara Freebie.
I believe Joey, the 6 tracks, I believe is the question. I believe Joey addressed the tracks.
Yes, so the tracks are the program, our counseling program, and kind of the types of tracks they can fall into in terms of class sequence, course sequence, and like specialty areas. So in terms of us just identifying sites, we really wanted to tailor it to the students and what kind of their interests were clinically. So we worked hard to find locations that offered adult counseling, individual counseling, but also had services for play therapy, couples counseling, group counseling, other opportunities for some of these tracks that are available to students within the program, as well as rehabilitation.
So it was adult, adolescent, school, college, rehabilitation, and child. Those are our 6 internship tracks for our students.
And if someone has one last question. Okay. So yes, thank you so much. This was a ton of information. So, so it says, hi everyone, glad you covered the challenges as that would have been my question. So it seems like your overall presentation was able to really clear up a lot for us. And as a whole, there's just so much information, and so this is also why we recorded it. So for the AMCD membership, you will have access to this when we upload it to the website, along with the slides which Dr. Cartwright provided, which was very nice of you. Did you have any final last thoughts you wanted to give us?
Thank you. Thank you for the opportunity and for taking the time this afternoon to sit with us and to have this discussion and conversation. We're very fortunate that you all were able to join us today. So thank you for the opportunity. Did you all have anything?
Thank you.
Thank you.
Awesome. So for all of our attendees today, as a reminder, you will get an email sometime tomorrow with the request for CEUs. That will also include a link to the PowerPoints. As soon as we are able, we'll get the video up on the AMC website for your review as well. We do not provide CEUs in the recording, unfortunately, but it's great information, so we hope that you will continue to be a part of our AMCD professional development series in the future. So thank you so much all for coming, and I hope you all have a wonderful day.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.